Dr. Tania Dempsey is the founder of the AIM Center for Personalized Medicine. Doctor, welcome.
Thank you. Thanks for having me.
What is the #1 myth or misconception about this novel coronavirus?
Well, that it is just like the flu. It's not just like the flu. It's highly contagious, more contagious than some other viruses that we've seen. It's clearly deadly, and it is being passed by many asymptomatic patients without symptoms. And you do need to wear a mask, no question about it, to protect yourself and to protect others, more importantly.
Yeah, we keep hearing it's to protect others, but I do feel safer with it on myself. Much of the noise in the news lately is about vaccine. Encouraging as these reports are, it's not soon that we're going to be lining up for shots at CVS, is it?
No, listen, we're probably a minimum of 6 months away, probably longer. They have to test safety. They have to test, lots of people. We need to make sure they work. They are gearing to approve a vaccine that's going to be only 50% potentially effective, right? So we're not talking about vaccines that are going to protect 90%. We're talking about vaccines that at best will protect 50 at a 50% level. So, but we're going to wait for that. It's going to be a while, and I have concerns about whether this vaccine will work. How many doses are we going to need? How often are we going to need it? We probably will need it multiple times. We'll probably will need it yearly after that, maybe more often than that. So there's just so much uncertainty, so many companies racing to the end here. But I don't see it happening anytime soon, and I'm not even convinced that a vaccine is going to work.
Yeah, a best case, suppose we get a vaccine tomorrow. We keep hearing that this coronavirus can mutate, as does the flu. Is it possible that when we do get a vaccine, it's going to be good for a year, and then there's going to have to be another vaccine developed for next year? And like the flu vaccine, there is a bit of educated guesswork each year, correct?
Correct. And I think you're right. I think it could potentially be the same here. And with the flu vaccine, you have this year where we're looking at we're in the northern hemisphere, right? We're looking at the southern hemisphere. We're looking at what viruses are there, the season ahead of us, and then we're preparing based on that. And sometimes we're right by a few strains, and sometimes we're wrong. We don't know about the seasonality of this coronavirus, this novel COVID, right, 19. So the problem is we don't know if it's going to be a year that we're looking at for mutations. We don't know if it's going to be less than a year or more, right? So the flu, we have a lot of experience with. We know we can predict it a little bit better. We don't know. This is a completely new virus for us.
I've heard conflicting opinions about getting the flu shot every year. Some say get it right away as soon as you can in the fall. And I've heard others say, think about February in the heart of the flu season. What do you recommend?
Well, it's a good question. I think it's patient-based very often. I mean, my whole focus of patient care is personalized medicine. So, it really depends on the patient. Patients who get it too early are going to be at higher risk months later because the effect of the flu vaccine will wear off. The antibodies and the other parts of the immune system that have to build up may not be as strong. So if you get it in October and we have a spike in April, those antibodies from that flu shot may not last, and so they may be more vulnerable then. On the other hand, we can't always predict when the spike is going to happen with the flu shot. So I like to say somewhere in the fall is probably a good time to get prepared, and but to keep in mind that if we have a later spike, that the increase in vulnerability goes up.
We're speaking with Dr. Tania Dempsey. We are seeing parts of the country, notably the South and the Southwest, light up when they show us those outbreak maps because they jumped the gun on the reopening. This is not a second wave. This is the first wave unheeded. Are we expecting a second wave in the fall? And being flu season, is that just going to be the perfect storm?
Yeah, it really sounds like a nightmare, to be honest with you. The symptoms are so similar. We're going to be having to test a lot of people. I don't know if we have the testing capability for COVID completely. We have the testing capability for the flu, but again, it's going to be tricky. I don't know about a second wave though. I'm going to be honest. I do agree with you that I think we're seeing a first wave in a lot of states. Maybe in places like I'm in New York, we saw a big wave in March, April, May. We're going to start to see a resurgence. We're already starting to hear of cases coming out. Maybe that's going to be our second wave. But again, I'm not convinced of the seasonality of this virus. We know the flu is seasonal. COVID was rampant in the spring. That's unusual for flu, right? So it's hard to say whether the second wave is going to come because of the fall or whether the second wave is going to come because we're all opening up again and we're going to be more vulnerable.
You have got to be horrified by this news footage we see of the pool parties in the Ozarks. There was just a big outdoor event on Long Island, and these are lighting up hotspots. Other than those flagrant abuses, what are some of the everyday risks that we want to be careful of?
Yeah, and that's a really great question. And it's something that, people who are really concerned about their health and their family's health are thinking about. Listen, the chances of picking this up at a casual visit to the grocery store where you've had your mask on, you've used your hand sanitizer, you've washed your hands is probably very low. Okay, because people are scared to go to the stores. But crowding in stores where there are a lot of people is not good. But if you're going to a store that's controlling traffic and you're watching yourself, lower risk. High risk, big crowds, even with masks, but better if you're in a mask than without one. Now, I worry about people who are really lowering their guard and are getting together with friends who they think are being safe, as they're being as safe as them. They think, they go to their house, they wear the masks initially, then they all get comfortable, they take the masks off, and now they're all comfortable in the house and feeling like they're not going to be affected by this. It's not going to happen to them, and then there they are without the mask, and 2 weeks later, 5 days later, sick.
Yeah, our governor here just lowered the bar. We were allowed to have gatherings of 25 people, and now it's down to 15 because when they get an outbreak and they do the contact tracing, you got one person at that barbecue who's infecting 7 others or so just by being there. And I got to think that claustrophobia has something to do with that because we've been cooped up so much. But I think now is the time to be vigilant. Other things we can do, getting a good night's sleep, cutting back on the cocktails to bolster our immune system. Do vitamins help?
Yeah, look, I'm a believer. I mean, that's my background. Practicing personalized medicine, taking care of complex chronic disease patients whose immune systems are compromised. So, how do we boost the immune system? None of the things that I'm talking about, none of these things are 100% preventative or 100% effective. However, they can help, right? So you mentioned sleep. I love that idea. Decreasing alcohol intake, decreasing carbohydrates, and eating good protein and fat, and nourishing your body and avoiding sugars, like number one. And as far as vitamins, things I think about the 5 big ones they're the ones that I recommend to all my patients as a baseline: vitamin D, vitamin C, zinc, glutathione, and N-acetylcysteine. I think you have your sort of bases covered. You're protecting your respiratory tract. You're protecting your immune system. Again, I'm never going to say it's 100%, but our food supply is not what it used to be. We're not getting the vitamins and nutrients that we should be. Lots of people are eating from their cabinets instead of the fresh produce and the meats, and so they're not getting the nutrients. So let's give it back, take it, prevent. See if you can protect yourself and your family the best you can.
Dr. Tania Dempsey, I know how busy you are, so I appreciate your time a lot. Thank you for being with us, and come again, will you?
I will. Thank you for having me.
You bet.